morning, colleagues. Thank you so much for trying to pronounce my name. We'll have a webinar session after. I have got a very difficult task today. Why? Because trying to moderate a session after such a powerful opening ceremony is not an easy task. So it's quite a difficult assignment that I have been given. But it's my honor and my pleasure to be here and also to be moderating this very interesting session that we are going to be having today. I think this is very close to me. Maybe I'm biased to it largely because I come from a regional institution too, the African Society for Laboratory Medicine. So this is a very dear topic to me, and I'm very much looking forward to some of the discussions that we are going to be having during this session. So in this session, we want to focus on the role of regional institutions as a steward for Continental unit in Africa's new public health order. So two key phrases for me in this: regional institutions and Continental unit. I think this has been, demonstrated a lot in the past couple of years that we need to move to this level. Now, I just want to maybe make a few remarks just to set the scene. And after that, I'm going to be inviting the panelists to come and sit with me here. So why is this important? To look at the regional institutions and Continental unit. Why is it an issue that we need to be talking about today? I think and I believe that Continental unit, we need it. Why? Because we need to create a more cohesive and interconnected continent in which countries can work together to address common problems. And not only that, we also have an opportunity even to promote some best practices. We all know that not all the countries in our continent have the capacity, neither do they have the assets to deal with so many emerging problems that we keep facing as a continent. So we need to become well coordinated. We need to be well aware what exists in our continent and how we can tap into these resources, how we can come together, bringing all our best assets so that we can fight the same challenges that we face as a continent. Why? Because these infectious conditions, they don't know borders. They don't respect them. And no amount of preparation sometimes can contain them in one place. So the more reason we need really to come together even as a continent. So as such, regional institutions or regional organization can play a key role in promoting continental unity by promoting cooperation and collaboration amongst countries within the region. So these regional organizations can serve as a platform for countries to perform a number of issues, but I'm just going to highlight just three amongst the many. Number one, they can help us to come together to address these common challenges and pursue shared goals. Secondly, to discuss and coordinate policies, share information and best practices. And lastly, to collaborate on regional initiatives and projects. And the good news is that Africa is not short of these regional institutions. We have them and they are very visible. Just to mention some that you already know, the Africa CDC. We have the new baby in the making, AMA. Also, we have got Auda NEPAD and many more. So Africa already is set to be moving in this direction. And again, I think it's also wise or very good to also just mention that in this conversation, it's also important to recognize one of the recent enablers for us to be, coordinated. I'm talking about the African Continental Free Trade Agreement that really opens up and connects all the 1.3 billion people in the continent across all the 55 countries. So what are we going to be doing in the next maybe 45 to 50 minutes before we break for lunch? We want to discuss the public health benefits from Africa's continental unity and integration. That's number one. Secondly, we want to give some background, some updates, and also plans for the new public health order for Africa. Of course, with a focus on how the private sector can contribute to this new health sector guidance for Africa. And hopefully we can have a call for action, a call for increased cooperation and action-oriented partnerships among regional institutions. So we are going to have a panel session. After that, we are going to also leave some time for, to take some comments and also engage the audience in some discussions. And lastly, maybe the last 2 or 3 minutes, we are going to ask the two panelists here to really give their parting shots. To help me really unpack this interesting session, we have got two wonderful panel of experts that I'm going to be inviting to come to the stage. I'm going to ask, we have got Mr. Fanny Hendriski. Let's put our hands together as Mr. Fanny Hendriski is coming to the stage. Mr. Hendriski is a seasoned professional with a remarkable career spanning over 25 years in various sectors of the healthcare industry. His extensive experience encompasses management, ownership, and board positions within the retail, courier, wholesale pharmacy, and medicine distribution sectors. However, it is his profound passion for innovation and technology that drives his ambition and contribution to global healthcare. Mr. Hendriski brings invaluable insights and innovative solutions to address the unique healthcare challenges faced by Africa. Thank you so much. Let's welcome Mr. Fanny. My second panelist is Dr. Imane Kendili. Dr. Imane Kendili. Let's put our hands together to Dr. Imane Kendili. She's walking to the stage. So Dr. Imane is a highly respected and accomplished psychiatrist and addictologist who has made significant contributions to the field of addiction medicine. She is a graduate of Hassan II University of Medicine and IBN Rothschild University Hospital in Casablanca, and has also received training in addiction medicine in Belgium, Switzerland, and the United States. Currently, Dr. Kendili is serving as the president of the Africa Global Health. In this role, she is leading the charge to improve health outcomes for Africans by bringing together scientists, experts, economists, and lawyers, but also policymakers in health in Africa. So again, let's welcome Dr. Imane. So I'm going to shift gears. so that we can have a conversation. And I just want this to be more of a conversation. And also, I would like to later invite the participants here to join us in really unpacking this very important topic that is looking at the role of regional institutions as steward for continental unity in Africa's new public health order. So, Dr. Emmanuel, so let me put you on the spot, just to get off in terms of our discussion today. I want you to highlight the importance. Just tell us the importance of these regional institutions, emphasizing on these regional institutions in terms of continental unity in public health.
Thank you very much. So let me introduce myself. I'm Dr. Iman Kandili, psychiatrist. I have the honor to like a president of African Global Health. Our vice president is from South Africa. He's Professor Morgan Shetty. He's not with us this morning. And we have all some of our ambassadors here. Dr. Rania Mamdouh. I want to thank our ambassadors from Egypt. Dr. Luana Patrick from Uganda. We have Dr. Amit Thakur from Kenya too. And Dr. Koleka, I think she's here, from South Africa too. So we are more than 3,000 experts across Africa. We are working, I have a presentation on advocacy for our next conference on September in Marrakesh. And we are working to lead or to move on, from the south to the north and to the north from the south, to work together and to find solutions to let behind us all politic things and to work together with our ministries, with our governments, policymakers and experts to find solutions for our healthcare systems.
I just, let me continue with you. I know during the COVID experience, Morocco was very, very visible, collaborating with Africa CDC. So how was that working with such a regional institution? Yep.
Yes, sharing expertise, sharing all we can share, not just our experts. We have many expertise in Africa, here in Morocco, in Egypt, everywhere. We can just share it. We need to share it. And we need to keep our expertise in Africa, not let it go outside Africa, in our continent. I was on the WHO conference with Dr. Tedros, and Morocco, Rwanda, and South Africa, where he congratulates these countries for the COVID-19 managing pandemic situation. So I think we can, all countries in Africa, make some bridges to work together. It's important to have the support of African Union, the CDC, and it's important to find other supports inside the countries and outside the countries. It's important to have this dream. I think I have a dream, we have a dream, like experts from African Global Health, and the dream is to find a solution to have an African voice all over the world. Our next conference is the second conference about health harm reduction, but also the first South-South conference with Asian countries and South American countries to try to make bridges, to find investment, to find how we can work together, South with South countries, to find solutions for ourselves. Because even if we are talking about institutions, big world institutions, Africa is the poor parent. We have to find how we can adapt to each other, to work together in the same voice, to be, Africa is the mother of humanity. And she's the future too, because we have more than 60% young people. For some regions, more than 70% of young people. So this young people is waiting us to pave the future with responsibility, solidarity, and resilience. Because like Africans, our rules, our African roots are based on solidarity, responsibility, and engagement. We have to not forget this and to let egos and work together and to move on to the future. Okay. We are different. We can't adapt public health policies from USA in Africa or from Europe in Africa. We need to have our lines. And to have our lines, we need to work together, to help each other. Because it's a shame, I think, it's my words, I think it's a shame for Morocco or South Africa or any country to move to the future, to have technologies and to make things without his brothers, because all the continent is concerned.
Okay.
Thank you.
Let me come to you, Mr. Fanny. What is your impression in terms of where are we on this journey of continental unity and integration? And where do you see the regional institutions in this journey, their role? And are we there yet? What your experience?
No, thanks, Mr. Ndlovu. So my name is Fanny Hendricks. I'm the Managing Director of Righty Pharmacy. So what we're all about is innovation, collaboration, customization of last mile medicine dispensing and distribution solutions. So we're an innovative startup that started in 2016. It sounds long ago, 7 years, but you must remember you must take 2 years away for COVID. I actually got a presentation that I would like to share with, when I'm done and when it's ready when you're ready, Mr. Ndlovu. But I think, in essence, Righty Pharmacy, is a for-profit business, and I think that's important to notice. And literally, our journey is we started off by being reliant on NGO funding to implement some of our programs, and that is now, we were fortunate to have, startup projects funded by USAID, followed by GIZ, followed by Global Fund, then CDC, but that now changed into different NGOs, and actually now we're coming out of our startup phases from a public sector perspective. Now we're venturing into private sector. So I think, and we started in South Africa and we're in 5 countries now. So although very small, it's really a field that's got, that's so hardly overlooked because of the difficulty to operate in a clinic or pharmacy to generate data. But, we're all talking about how we're going to do this, and everybody's talking about AI and all this stuff. But, our little role in the bigger picture is to say, what are we good at? And how do we collaborate with other partners to make it happen? And what we've seen is since 2018, beginning of 2019, is really a lot of interest in what we're doing and some very key collaborations to bring us to where we are today. And we're still very small, but we pathfinders in generating solutions that's patient-centric. So I think the reality is sometimes we've got especially in the academia world, especially at the NGO space, we've got a top-down view. We would like to say that we've got a bottom-up view, and we start by talking to patients. We're getting solutions in that the patients want. We don't go and take solutions from private sector and force it on patients. And those solutions, to summarize, is actually differs from patient to patient and country to country. But I'll share some more on the presentation I've got.
All right. So I think at this point, Dr. Imane, maybe you want to take us through your presentation, right? Okay. So colleagues, can you set the presentation?
Please, the presentation. So, ladies and gentlemen, I would like to extend my heartfelt gratitude to Dr. Amit Thacker for extending this kind invitation to speak today. I would also like to express my sincere appreciation to the entire AHB team for their tireless efforts in organizing this event. It is an honor to stand before all of you and address such an esteemed audience. Today, I would like to shed light on an incredibly important topic, the role of the private sector in Africa's new public health order. The challenges we face in the realm of healthcare are vast, and they require collaborative efforts from various stakeholders. The private sector, with its innovation, expertise, and resources, plays a crucial role in shaping Africa's healthcare landscape. In recent years, we have witnessed remarkable progress in healthcare across the African continent. However, there is still much work to be done. The private sector has a unique opportunity to contribute to this new public health order by investing in infrastructure, research and development, and capacity building. By partnering with governments, non-profit organizations, and local communities, the private sector can help bridge the gaps in healthcare delivery, improve access to quality services, and foster innovation. Moreover, it's essential to envision a sovereign African continent where nations take care of their own healthcare systems. Africa possesses incredible potential and resources, and it is high time we tap into this strength to build self-reliant healthcare systems. By fostering local expertise, promoting innovation, and leveraging our collective knowledge, we can empower African nations to address their unique healthcare challenges effectively. In the wake of the COVID-19 pandemic, it has become increasingly evident that a political approach to public health policies is imperative. We witnessed solid public-private cooperation between various sectors, such as health safety and the pharmaceutical industry, enabling effective management of the pandemic in Africa. Countries, like we said, Rwanda, South Africa, and Morocco, were rightly commended at the last WHO conference for their proactive response. Professor Aitaleb, our Minister of Health in Morocco, said, "Today, we are working together to optimize healthcare pathways and ensure a better return on expenditure and investment, whether in the public or private sector, while reinforcing the quality and safety of services and guaranteeing equitable access to quality services, safe services, timely services that meet the needs and expectations of all citizens." The success of the overhaul of the national healthcare system depends on the involvement of both public and private sector stakeholders. Thus, integrating the private sector into the national transition will help improve healthcare provision and sector governance. This overhaul aims to ensure access to safe, high-quality, effective medicines through a new pharmaceutical strategy. It is the commitment of the parties concerned that will support the progress of this overhaul and enable us to establish a favorable social climate based on improved working conditions and remuneration for healthcare professionals. The pandemic has also highlighted the significant determinant of public health, the culture. Africa, as the birthplace of humanity, holds not only our past but also our future. Africa's values of family, solidarity, responsibility, and commitment are our guiding principles. Today, more than ever, Africa needs to transcend borders and unite its forces. It is essential for every African country to reach out to its brothers and sisters from north to south, and from south to north, sharing expertise, human resources, and financial resources to build together a united, responsible, sovereign, strong, and independent Africa. Our focus must be on building bridges between African countries, between experts and governments, and between experts and policymakers. By doing so, we can pave the way of a brighter future. In light of these discussions, I'm thrilled to announce our upcoming conference scheduled for next September in Marrakesh. The conference themed Health in Africa, Water, Environment and Food Security will serve as a platform to bring together over 100 ministers from Africa and beyond. This gathering will not only represent health ministries, but also include representatives from agriculture, water, foreign affairs, and other relevant sectors. The conference will provide a unique opportunity to consolidate our expertise, exchange knowledge, and foster collaboration by bringing together diverse perspectives and sectors. We can explore, and so we can have the good slide. We can explore holistic approaches to healthcare that encompass water, environment, and food security. These interconnected issues are fundamental to the health and well-being of our continent. Through dialogue and cooperation, we can develop comprehensive strategies that address the underlying determinants of health and build a resilient healthcare ecosystem. I invite each and every one of you to join us in Marrakesh this coming September. Let us seize this opportunity to engage in meaningful discussions, forge partnerships, and collectively work towards a stronger, healthier, and sovereign Africa. Together we can create a brighter future for our continent, where every individual has access to quality healthcare and the chance to thrive. To this end, I'm delighted to present the Health Sovereignty in Africa, the Advocacy, a groundbreaking document directed by Professor Shetty from South Africa, Dr. Amit Thacker from Kenya, and myself, drafted by over 40 individuals from across Africa, as well as contributors from various nations worldwide. The advocacy serves as a comprehensive framework that encompasses our collective wisdom and shared commitment to patient citizens. This advocacy represents an amalgamation of diverse perspectives, experiences, and expertise, all converging towards a common goal, reducing harm and promoting safer healthcare practices for all Africans. Like I said, health from Africa for Africa, health from Africans from Africans. Thank you once again for your kind invitation, and I look forward to welcoming all of you at the conference in Marrakesh. Thank you.
Thank you so much, Dr. Imane, for that presentation. Let me invite Mr. Fane to also give his presentation.
Yeah, so I think, I think we're so far behind on the program, so I'll try to be as quick as possible and as impact as possible. But, it's one thing, normally the politicians take the time and in private sector need to sort it out. So, we're just waiting for the slide to come up. But anyway, I think if you discuss all these things and the buzzwords coming in the next couple of months and years is obviously data, digitization, AI, all of those things. But I can tell you one thing that I think to do that is one thing, but to talk about it is actually the easy part of it. We're doing it in the last mile, like I said to you. So I'm going to just take as little time as possible and explain it from our perspective as an innovator in digital health, in the dispensing side, a bit on our journey, and just highlight some of the things we went through. So I think the first thing that we need to acknowledge is obviously all the healthcare challenges, and I don't think this forum needs any explanation. I think what we've summarized in our journey was coming to this, and this also varies from country to country. I don't think there's always something different. I think working in Lesotho, we saw obviously high migration is a big challenge, and just the geographical area. But I think that can all be summarized in that, and I'm not going to focus on that because I think we all know that's one of the reasons why we're here. I think the innovation challenges and systemization challenges that we experienced during our journey can be summarized in in the next 8 points. Obviously, I think innovation is one thing, but as soon as you go into a regulated environment, it becomes a bit of a nightmare. Bureaucracy, let's leave it there. Innovation costs and funding. I think what we've seen is, you don't take off-the-shelf systems and solution and just plug them in Africa and play. So it comes at a cost. But once you've done it, it's all about customization and expansion. Innovation readiness, there's unfortunately, when it comes to healthcare, there's people that's got a problem for every solution. And that's one of the things that we've learned. You can take a small part of the industry, focus on it, and there will still people be like, what about this? What about this? So I think innovation readiness, that filters down to the whole healthcare sector as well. And then innovation equals opportunity, not a threat. We've seen in one of our installations where we literally worked with a 64-year-old lady that never had worked on a computer or dispensed on a computer before. And now is actually at that facility, I think, number 4 when it comes to capturing prescriptions. And then obviously, when you add innovation and automation, you do think that, you're going to take people's jobs. What we're actually seeing is the overburdened facilities are now got about a 65 to 75% higher output on servicing patients. Change management, massive point, and I think highly overlooked at doing projects in Africa. So change management that comes from political, regulatory, healthcare worker, patient, community, etc. All those layers that you need to work through. Skills transfer, it's actually the challenge, but the nice thing is if you do it, your solutions patient-centric, it actually becomes easier. Then duration and project time, I think that's more related to some of the donors and NGO funding awards. We've seen a decrease in the time. So the reality is that because it's costly, the project timelines always gets cut. Then integration. I think integration in a healthcare system which is quite fragmented and literally in silos. We need to overcome integration, and we've really on our side has done everything possible to make it possible to integrate with anything. And then obviously sustainability. I think we're talking about the health, private sector being part of it. Private sector stays a business, and obviously I think the sustainability is actually a relative point. But I do think it's what is your definition of what do you want to see? Some businesses want ROI, some want a social impact, and I think it's to find the middle ground. So we've got various products, but I'm just going to give you a very short video to show some of them. I'm just going to highlight the impact after that of some of them. So you can go and play the video. Thanks.
Africa's healthcare facilities face numerous challenges, including limited infrastructure, restricted medicine access, inadequate digitization, and difficulties in patient and supply chain management. Right ePharmacy offers practical solutions to address these challenges effectively. Our comprehensive range of services focuses on last-mile dispensing, distribution, and collection of medicine, catering specifically to the needs of patients in the public health sector. Key to our solutions is the utilization of real-time data, which is made accessible through live dashboards. This data-driven approach enables improved forecasting, dispensing, and tracking of specific commodities. Additionally, our solutions include customer adherence monitoring, supported by remote call centers to ensure patient compliance and managed care. One of our cost-effective dispensing solutions is the Central Dispensing Unit. By leveraging supply chain information and specific dispensing data, the CDU digitizes prescriptions, pre-dispenses customer-specific prescriptions, and facilitates their delivery to convenient pickup points or collect-and-go smart lockers. Designed for both urban and remote customers, Collect and Go smart lockers provide discreet and accessible storage for medications. This 24/7 accessibility ensures that patients can conveniently retrieve their chronic medicines. To enhance parcel tracking and logistics, we have developed the ERX mobile app. This mobile application enables real-time monitoring of customer parcels, ensuring accurate and timely delivery from the point of dispatch to patient collection. In urban areas with high patient volumes, our disruptive innovation called Pharmacy Dispensing Units, or PDUs, also known as ATM pharmacies, offers a holistic patient solution. These units provide contactless counseling through live video links to our telepharmacy call center. With on-site robotic picking, dispensing, and labeling of patient-specific medicines, PDUs streamline operations, improve efficiency, and enhance the overall customer experience. Additionally, Right ePharmacy offers pharmacy automation solutions to alleviate the burden on hospitals. By adopting automation technology, hospitals can optimize their pharmacy operations, increase speed, reduce human errors, and enhance customer safety and satisfaction. Our commitment to patient-centric innovation and strategic collaborations drives the development and implementation of our technologies. We strive to strengthen healthcare systems in Africa, ultimately benefiting patients across the continent. Right ePharmacy is your trusted partner in building resilient, patient-centric solutions.
Yeah, so I think we can go to the next slide. That's just a high level to just show you we're not writing papers, we're actually in the field. So I'm just going to highlight some of the social impact that we made and obviously some of the numbers. So in pharmacy automation, we currently got 3 facilities automated and we actually done over 16 million items. And then obviously I think the most big benefit of that is obviously all of that is digitized and 60 to 75% higher output. We can go to the next slide. On the PDU, that was a pilot study. We've done 1.3 million items dispensed, and we've seen, number of items dispensed 1.3 million, and a total of 760 dispenses. That obviously, I think the cool thing about that was the live counseling and collecting your medicine for 2 months in under 3 minutes. And then obviously, very important for better healthcare outcomes, 96% adherence rate. Next one. So central dispensing facility, that's in essence where we take overburdened facilities, remove their chronic stable patients to a centralized facility for alternative pickup points. We actually currently, we're in 3 countries, Lesotho, South Africa, and we were also in Zambia. I think the key thing about this is the simplicity of the prescription receival process, where about 70% as we receive it is already digitized, and the pharmacist at the central facility actually just need to capture the outstanding information, schedule the next delivery date, and then obviously deliver at a convenient point that's more convenient to the patient as and not the healthcare facility. Next one, please. Then I think currently our flagship product is the Collect and Go smart lockers, obviously known in the e-commerce space. For e-commerce, we adapted it. It's now locally manufactured and widely used. It's actually our latest product, but you will see that we've already had 739,000 collections of medicine. It's got 24/7 availability. It's got a full remote managing system. It also contains very cool technology that was in collaboration with Amazon Web Services, AWS, which we call disconnected connectivity. For those of you who wonder about power, it's got a lithium backup power capacity of 6 to 9 hours, and currently we've got a 95% collection success. Then I think currently our flagship product is the Collect and Go smart lockers, obviously known in the e-commerce space. For e-commerce, we adapted it. It's now locally manufactured and widely used. It's actually our latest product, but you will see that We've already had 739,000 collections of medicine. It's got 24/7 availability. It's got a full remote managing system. It also contains very cool technology that was in collaboration with Amazon Web Services, AWS, which we call disconnected connectivity. For those of you who wonder about power, it's got a lithium backup power capacity of 6 to 9 hours. And currently we've got a 95% collection success. So that is just some of our products, and this is what happened in the 5 years that I mentioned. So currently we're in 5 provinces in South Africa. We're also in Lesotho, we're also in Botswana, and we're also in Eswatini. And like I said, we also entered the private sector with the likes of De Beers and Anglo American. And then we're at advanced stages of talks with Nigeria, France, Greece, Namibia, Isle of Man, and Zimbabwe. So we're looking forward to the next couple of months. I've put this slide here just to summarize what we've done. 5 million dispensers, 18 million items. And then I think, we are well recognized internationally for what we've done. We've got 1 international award, 3 in South Africa, 1 in India, 1 in Germany, and then 1 award winner in America and 2 finalists. I think I wanted to put this slide in to show to you what is part of our success. I think we were a facilitator in making sure that the collaborations work. So collaborations is not only funding, it's integration, it's support partners, it's ministries. So, and that actually happened in the last 5 years. And I think that's one of the key takings that we need to do when we want to go into the next phase of disruption and innovation. Actually, this morning on the radio, driving from Pretoria, there was a guy talking about that a big cargo train at a station, in a flat station in Germany, they picked up that train was kept still by 2 20-centimeter wooden blocks. Okay, so a train that travels at 30 kilometers an hour can't be stopped by a concrete block. So it's all about getting into momentum and not being stopped by the small wooden blocks. And I think that is our job as healthcare leaders. Thank you.
Thank you so much, Mr. Fani, for that very interesting presentation. I just want to pick up from the last point that you made on disruptive innovation and also link it to its challenges. So how do you see the regional institutions or other partners that really can? What do you think would be their role in really, scaling up such kind of an, disruptive and very positive innovation?
I think it starts with willingness of key stakeholders. We started off in South Africa, and while we were busy, we were asked by other countries to do small pilots and get involved. And I do think, the where you see the most success is actually where you see the most willingness. And the willingness starts with the ministry. It starts then how it filters through to the healthcare worker. So willingness for change is massive. And I think that's a success. I mean, you can look at Rwanda, the previous speaker on Kenya, it clearly shows willingness. And that's why those countries have been earmarked for disruptive innovation and got open arms for any kind of innovation or system to improve the patient journey.
So there will always be early adopters. So what is your plan for those countries that maybe are not that ready for this kind of disruptive innovations? How do we move them forward?
They can phone us. Yeah, I think what's quite important is that the set of rules, the regulations, all of that comes with the change management and the willingness. And I think we're trying to be a holistic business that actually take care of that as well, because it's like I said, there's a lot of challenges if you go through all the challenges that I mentioned, but it's what do you bring accept a solution. So what we're bringing with the solutions is, we bring you a guideline that you can adopt to your country. It takes engagement with regulators for adoption. But again, come back to my point, willingness makes all those things go away.
Okay. Before I come to Dr. Imane to just talk about, research, you mentioned a couple of things around infrastructure and research, how that can be enablers, to build that capacity, to develop even some of the technologies and the tools we need for the continent. While you still are thinking about that, Fanny, you presented a slide with a couple of challenges, change and everything. So what would be your top two that if really something is done on these two, this could be, it could move the needle? I know you had almost 8 to 10 of them, but which ones will be your top two there to say, if as a continent, if we are to move forward, and accept and embrace innovation that really is coming to address some of our unique challenges, what will be those, areas to focus on?
You said top two, so number one is the top four, and number two is the bottom four.
Yes.
Okay. So I think it's. I don't want to say maybe there is, So there's a tie between bureaucracy and willingness, and I think that's the first thing. And then I think there's smaller challenges and bigger challenges, but that would be one of the two. And then I would say, obviously everybody wants it, but it always comes back to funding. Funding and sustainability hand in hand.
Okay, so bureaucracy and funding. Okay, let me come to you, Dr. Imane. I think the issue around, research and development has come up since, this meeting. So how do the regional institutions, I know you're working with a different number of organizations, how can we, what would be their role, to facilitate
we have to use
this?
technologies and digitalization to make links and bridges. It's more easy now with with internet and everything. And I just want to add something, because it was very interesting to listen to you. Morocco began a big reform of healthcare systems in 2021 by injecting $51 million, especially for digitalization and for insurance, because it's very important to have an insurance for all people. And it's working because it's a public-private cooperation. It's already a success, because we are working on it more than 2 years. And we are working on it even if with other countries in Africa to try to make links with telemedicine, technologies and everything connected healthcare. And I think we have to use and to share expertise of everyone, I didn't know your company, but I'm very happy to know you today. And I think by sharing and by working together, we can make everything possible.
Okay, so talk about sharing. I mean, where do you see? I mean, how has it been moving? Before you answer, I want to just come to the audience and want to open this up for any comments, any questions to the panelists, or even just a contribution to this conversation today. So please just be ready after she finishes. So you talk about sharing, and you've mentioned a number of countries. How is it?
We have lawyers from Africa, a coalition of lawyers from Africa and from other countries to help us. I'm not driving it, because we need lawyers to do it. They are making a paper, guide. They are making guidelines to present it to our countries, to African Global Health and to CDC and African Union, because we are already sent letters to have support of them, and all countries to find the guidelines to work together and to share, because we have a commission. This commission, I think it's more than, because I'm not driving it, because I can drive everything. We have lawyers from Africa and some lawyers from USA, but Africans from USA, to help us to find the good laws to drive this sharing, to drive it correctly, to drive it with a good, in good shape. So, and this guidelines will be presented on September to all countries in a minister summit to find solutions and to find and to write recommendations to work together. But to work on it, we have a commission of lawyers.
Okay. All right. Thank you so much for that. I just want to invite any one of us, if you have got any comments and any. Can I have the mics moving? I see there are two hands here, but let's start from this side there. Our dear colleague, if we can also have some mics closer to our colleagues this side.
Thank you to the presenters. Dr. Patrick Ruaga from Uganda. My question goes to Dr. Fanny. When you presented the figures, and really thank you for the innovation, I think that that addresses part of the human resource issues. But when you presented the numbers, I saw that the dispatches and the collections were different. There were fewer collections. I wanted to understand why is it so, and what are some of the challenges that you face with this system? Thank you.
No, thank you for the question. I think so. Firstly, that is a combined statistic of all the countries. But to give you an idea, and I'm going to use, let's say, South Africa for an example, government decides how long a patient's got to collect their medicine. That period was from a pickup point. So that period was extended during COVID. But to give you an idea, our collection rate overall sits at 95%. So we're actually scaling in successful collections. So those guidelines and waiting periods are set by the various governments. Lesotho, 7 days, South Africa, 7 days, some 4 days. I mean, we're sitting in, we just started in Eswatini, and I think the average waiting time for a parcel in the smart locker is 2 days. So it's not that it's uncollected, and that's why you've got a 95% collection rate when you boil it down to the actual collections. The reasons for non-collection is sometimes that patients actually go back to facility or has moved from the area or passed away. So I think to give you an idea, if we phone the office now, we can actually give you a 100% accurate live percentage that's collected and uncollected. That's just the way that the technology is. So it's not a, for us, we're actually we're looking forward to the next month or 2 months and 3 months as that collection rate is starting to climb, because in essence, that's our youngest project. I hope I'd answered your question.
Okay, I saw two hands here. Yes, you can go ahead.
I am Adrienne Leuser. I'm an independent consultant working in the space of enabling stakeholder management and partnerships. And I'm very impressed by the work that you are doing, Fanny, in bringing forth disruptive innovation to enable improved health outcomes. I work very much within the innovation space, particularly with biotech startups. And there is a lot of innovation, and I think it has been highlighted again here over and over, innovation, R&D sitting in the academia, and how to bridge the gap where we're seeing solutions like yours getting to the patient. And I'm just curious, in your journey, what sort of maybe top 2 tips can you offer to other innovators on how to, be embraced? I loved what you said, innovation not being a threat, but rather an opportunity. I encounter that a lot with my clients, trying to bring their innovation to the table to have, partnership discussions with either, very much established companies or even with the public sector. So what were some of the tips? That's the one question. And then the other question, I loved how you referred to the bottom-up approach, where you're working with communities to figure out, the problems and the desired solutions. But on your last slide, I think where you displayed your stakeholders and collaborators, I was looking to see maybe a partnership with a patient organization. So I'm curious, how did you go about having those conversations and engagement with the community to source either the issues or the desired design for solutions? Thank you.
Thanks for the question. I think, innovation is not a switch on. It's quite a journey. So I think the first thing, you need to be very patient. The fact that you're doing it in healthcare makes it just more complex, and just adds more layers. So obviously time is the factor, and obviously discussions with the key stakeholders, and I would say that includes funding. So it's really on how do you bring the message to the people, and I'm talking about everyone in the value chain. And I think sometimes what I've seen is people innovate for the sake of innovation and not for the sake of the patient. So it's really, how do you overcome that, is by bringing everybody on board in a way that suits everyone. And that's why I say you can't take off the shelf innovative solutions and just force them down the patient's throat. And I've got a saying on my phone that says, and we're talking about Africa's new public health order. This sits so well with me in the way that we're thinking and our team is thinking. It says, when we want a different system in health, we need to start moving differently. Old keys doesn't unlock new doors. So that's, I think, the essence of what we're doing. So change management at patient level, I think we've learned a lot. I mean, the one thing that we're also not showing here is what's not working. There's a lot of things that's not working. But what I think one of the most successful things that we've done is actually, before we implement programs, let's say, for instance, one of our biggest uptakes was actually in the rural Mpumalanga, with right to care in that area, just embracing the technology. But what we've done differently there is, 6 months before we went into that area, we went on community radio stations, not us, not healthcare people, just the community people, and say, listen, phone in tonight, tell us what is your biggest problem of accessing your medication. And then, they get 15 answers, and you say, so next week we'll talk about how can we fix it, and you just take them on the journey, and then the day that you introduce, you let the people from that community introduce the technology, and not you as a healthcare person forcing I would say, the agenda. But by the time that you're implementing, all the people on the ground actually knows about it, and they go actually to facility and ask for it. So it does differ from area to area. You can't, in Soweto there's, lots of community radio stations, so you try to cover as much as you can. And then I think, activation at site level is one thing at the healthcare worker point, because that obviously that buy-in is where the patient source sits. That's where the decision gets made, who's chronic and who's stable, and that's where the patient needs to convince to collect at a different pickup point. That goes with training, and site activation. But, there's no golden answer to that. It really depends which layer of the supply chain you're talking to.
I know we are running a bit out of time, almost like 5 minutes from our lunch break. Yes, I'll take a couple, just a few questions, and then we start wrapping up. Yes, go ahead, and there's another hand at the back. Yes, go ahead.
Thank you. So my name is Talitha Newton. I'm from Mezzanine. So I had a question. The session is around continental unity and how regional institutions can assist. And it's great we've got ASLM on here. And if you look at knowledge sharing across the African continent, it's primarily in the healthcare space, more of a clinical, knowledge sharing. Do you think there is room for these institutions to, in essence, collaborate and bring about knowledge sharing forums for ministries of health, whereby they can then share what they are doing in countries, which programs are working, what's not working, so that we spoke about 400, 500 years just in terms of training and getting programs up and running and all these kind of things, so that the progression is faster within the public healthcare space.
Well, I'll take that from the ASLM side of things. What we have done recently is we started a program, maybe some of you know it, it's called Strengthening of Laboratory Community of Practice. And the essence is to do exactly that. Let's take the quick, easy wins that are happening across the borders. Let's begin to have that, sharing and really promote those best practices. So we are already doing that. We are bringing a number of countries. We start by setting what we call like teams in each country. And then we do some assessments around in terms of what is working. Of course, we initially started with HIV. We are expanding to TB. We are dealing with issues of waste management and all that. So it's really, we also addressed a lot around even COVID at that time. So that's another approach really to bring everybody. And this is and these communities of practice are actually led by the ministries of health, so that there is that co-creation and also there is that learning, so that we don't take the 400 years trying to really fix something that another country next door has actually done perfectly well. So that platform of sharing, and then we even provide support, to really kind of get them started in implementing some of these innovative interventions that may have succeeded across other countries. So I think that has really worked very well for many countries, and we continue to expand.
I want to add something. I forget last week, a big company from Morocco, pharmaceutical industry, was in Kenya, not just for sharing, but to implement together with many countries, and Kenya, factories, pharmaceutical industry factories in Kenya. So I think we just need to want it. Last November, the Moroccan Marrakesh Declaration was signed by more than 43 countries from Africa. We had 14 recommendations. Our General Secretary is not here. She's Dr. Tinde Mirza. She's from Zimbabwe. She's working on it. And she's working on the African Public Health Charter, supported by UNESCO. And we already send letters to African Union and the CDC to support too. The purpose is to find not just guidelines to do it, but to find a good practice to go fastly, and not just talking for talking, because we need to be efficient, and we don't have time, because I was on the WHO conference, and we are talking about next pandemic situations. So I don't know if all pandemics are, Africa is concerned by all pandemics, but I know that we need to find our proper solutions.
Thank you so much. I want to move to the back there, yeah, quickly. Yes, go ahead.
I saw that you guys have a call center, and already by the amazing work that you're doing, you're already supporting one specific key component, which is accessibility to life-saving commodities, across South Africa. My question is around, have you been thinking on how you support these patients once they already pick up the medicine through that journey? And maybe you can speak a little bit more about that call center, if it's around, things such as an adherence component of it, information about the commodities itself, so that, not only they have access now to the commodities, but, they get that support that they need through the journey, hopefully to completion or something like that.
And so the call center is available for any centralized dispensing patient. The platform is there. It's what you use it for. We're currently looking at other functionalities for lockers, like pre-exposure prophylaxis, test and start medical devices. So the backbone is there. It's healthcare people. So it's really how we can leverage it to just not only focus on what we're doing, but other programs in the area is doing as well.
Before we go to our last comment or question, I want to put Uganda, our senior official here from Uganda, the government, to give us, after she finishes, to give us some, one parting message. How can, as a continent, support innovation? To really, gain the momentum and gain the ground and really solve some of our challenges from the government perspective. What can be done to really support innovation? And with that, after our senior official, we are going to close this meeting. Yes, please go ahead.
No, thank you very much for the opportunity. My name is Gladys Buhoshi. I'm currently the CEO of Charlotte Maxeke Johannesburg Academic Hospital. I really want to congratulate Right to Care for coming with these two technologies. In fact, I was the CEO at Helen Joseph when you implemented the first one, the one that is at Steve Biko and Helen Joseph. And just to encourage people, it works. And when we talk about that, you still cannot replace technology with people, but you can make people and technology to work better to bring efficiency. And I have seen in terms of that, how the few pharmacists and assistants tried to attend to the long queues and reduce the waiting time with that technology. The second one is of the PDU, which is the one I have, I want to get your view on. Again, when it was rolled out in Gauteng, we were all very excited. Now, Charlotte is a central hospital, so we were given a target of 4,000. Very difficult to get people to buy into it because our country is still very hospice-centric. People do not believe in going to a primary health care, and they believe the tablets at Charlotte are different than the ones at the clinic. And so one of the things that actually assisted us to put more was during COVID. And I guess it would be very interesting for you to go and look at that, because I think before that, we had very, very few patients, and then because they couldn't come and collect, we were able to fast-track it. But two things that I want you to comment on. Because we are a central hospital, the essential medical list is only for primary health care. The patients that come to Charlotte, you'll find that they also have the EML list of other higher. And so we are unable to move as many patients down as possible, because then they still have to come for that particular medication that they cannot get at that level. The second thing is that in Gauteng, the community is highly mobile. Only when you want them to go and collect in Soweto, they say, actually, I'm from Eastern Cape. So how can you also look at the very same patient who is at Charlotte go and collect in Mpumalanga? Is it possible? Because that's what is happening. They travel all the way to come and collect that and they are adhering patients. We know that they will do the right thing. but they can't collect at Soweto because they still have to take the train or whatever to this. So my two questions is about that. The second is about, and I know you need to work with government in putting the other EML so that we can take out the 1,800 patients that come to Charlotte every day that can just go next to them. And it helps with NHI because it's access and equity nearer home. They don't have to spend money, they can take it anywhere. And lastly, if you can share your challenges that you have had and what solutions have you come with? Thank you.
So,
You'll have to.
So thank you very much for that, and it's nice to hear the positive side from your end as well. Really appreciate that, ma'am. And yeah, so I think what we've seen is with COVID, what you said is so true. We've seen a rapid uptake, especially on the collect and go smart lockers, because the external pickup points in shopping centres and etc. was closed. So you actually had no other option. I think one of the other observations that I need to say to you is there's a perception, and again, if you listen to the patient, what is their most convenient pickup point? And we all think it's a taxi rank, we all think it's a shopping center. It's not. It stays the facility or the surrounding area of the facility. So we actually moved most of our collect and go smart lockers back into quieter areas of the facility. So not only does the healthcare worker sees where the patient collects, it gives him the comfort that it's there. So, we need to listen to where patients vote with their feet. And I think that's the cool thing about collect and go smart lockers. It's inexpensive, it's scalable. I think in Gauteng now we've got 34, 38. But the reality is we're in 5 provinces already. We've got the visibility of that. But in total, we've got 100 and something lockers. We need to have 1,500 lockers. And then, the control tower that I know is a debatable point on its own. If you've got that visibility and the dispensing data of the last mile, you can manage any patient in any province. So it's all about scaling what we currently got. Then it makes it easier for the patients to manage, because you can also then, because it's temperature controlled and monitored, you can also, if the patient doesn't collect, the commodity is still in the correct format that you can do reverse logistics. So it's not a loss. It's just an uncollection maybe collected in another province.
Thank you so much for that. Yes, I want to give Uganda just some closing remarks on this issue of innovation. How can we promote it even as a continent?
Okay, thank you very much. Joseph Okware, again, is my name. I work with the Ministry of Health Uganda at top leadership. Thank you very much, the presenters. Unfortunately, I missed both the presentations because I was in a side meeting with my Honorable Minister. But it's such an exciting conversation, and it's the way to go. We all agree that the pandemic, COVID, made us understand that the innovators not only need a place at the table, but they need a portion of the budget. Because when the traditional means and methods could not work, we had to call in the young people with various types of innovations, because we could not go beyond the boardrooms. The problems were out there, and there was a pandemic to collect data, to connect A and B. So the innovators showed that they deserve a place where we be. Secondly, there is a saying that the problems that we face today cannot and will never be solved by the same level of thinking that created those problems. The same level of thinking that we had then that created those problems, we can't use the same level of thinking to solve them. So we need other people with higher levels of thinking, and those are the innovators, to come and help us to solve those problems. So there is room for innovation if we are to move forward. But we need to walk the talk. Many times, the big people talk about that we promote innovation, but they don't actually do it when it comes to resources, when it comes to support. So we need to create space in our countries for innovation to grow, create budgets, and this is what we are trying to do in Uganda. Our president has created a ministry, a whole ministry for innovation. And the ministry sits in the president's office. So it's right within his immediate reach, and he's following what the ministry is doing and has provided a budget. So it's the way to go, because they have another level of thinking. When you have a solution, just throw it out there, and you'll be surprised the big number of people who will come out with the technologies and ideas to solve them. They have the solutions for these problems. Thank you.
Thank you so much. I cannot add any more. I think those were quite great parting remarks for this session. So, colleagues, please help me to give some a round of applause to our panelists today. Thank you so much. Thank you so much. I'm going to hand over the mic to our master of ceremony as we take our seats. Thank you so much.
Thank you. I think, what's always interesting about conferences, I guess maybe I'll speak first to Mr. Fani and his presentation is, so I mean, I'm from Zim, but I live in South Africa. And one of the things that's quite interesting is that one of the things we dealt with was a stigma of HIV. What would have happened if this kind of technology was available in 2000? Makes you wonder, right? No. Dr. Iman, it's always impressive when I hear you speak. For those of you who might not know, she gave a presentation in your third language. Second, third? It's always impressive, when you have your home language and then she can speak French and then she can give a Sorry?
My native language is French.
French. But to be able to speak and present in another language is quite impressive. I guess countrymen always doing us proud. Can you just maybe do a photo for us, and then I'll release you guys, and then people can go and have their lunch. So, photographer? Yeah.